Republicans in Congress are taking steps to repeal the Affordable Care Act. Democrats are trying to save it. With all the uncertainty, there's still a push to get more people to register. 41 Action News anchor Patrick Fazio interviewed the CEO of healthcare.gov, Kevin Conahan, and it's an interview you'll only see right here on 41 Action News.
Well, Congress is already starting to repeal the Affordable Care Act, but you're still encouraging people to sign up for it. Why is that?
Well, I think it's for a couple of reasons. Number one, it's the right thing to do for people's health and their financial security. Number two is because all our plans are locked in for 2017, and any discussion about repeal, replace, amend, refine will be a post-2017 activity. And the third is that there's just 2 weeks left for people to enroll through healthcare.gov. So January 31st is the absolute deadline.
All right, and the Congressional Budget Office just released an estimate saying 18 million people would lose insurance coverage in the first year after Obamacare is repealed, especially if it's not replaced right away. So that would take effect next year. What do you think about that estimate from the Congressional Budget Office?
Well, it's a very profound and significant report. In addition to the 18 million that you reported, the report also says that in future years, an additional 32 million would be at very severe risk of losing coverage, and health insurance premiums would be projected to double in the next 10 years. So I think it just underscores the fact that Congress needs to be, and the President to be extraordinarily careful about their activities. We've got legislation, we've got a law right now. No law is perfect. There's opportunities to amend it and refine it, but it feels to me at least that we should build on what we have.
So there's no plan to replace it yet at this point. How long would it take healthcare.gov, how long would it take you to implement a new plan whenever there is a plan to replace it?
Well, as you know, the real challenge on the replacement side is because the Affordable Care Act actually is the replacement plan. It was created about 20 years ago as a reaction to plans put forth in the Clinton administration. So that's really the major challenge in replacing it, is in fact it's actually the replacement plan. Your question about operations is highly dependent on what the details of the new plan might be.
You can check out KSHB.com or the 41 Action News Facebook page to hear the entire interview. You'll also hear what the CEO of healthcare.gov has to say about increasing premiums.